It starts probably around in their 40s. We don't really see guys in their 30s with it, but really around 40s you can start having symptoms due to the enlargement.
There are men who never get it.
Oh, sure, yeah.
But is there a profile that distinguishes one from the other?
Uh,
Which group had it and was vulnerable for it, which group is not?
Well, the larger the, we'll go into this a little bit, but the larger the PSA, the more likelihood that you're going to have a larger prostate. In age, really, that's really what I'm familiar with. I'm not.
It has nothing to do with ethnicity or.
There's a whole lot of controversy as far as diet, genetics, that sort of thing. So there can be. We don't know all that, but there has to be some component to that. Absolutely. Yeah. But
okay, one thing is it. There is genetics does play a part.
Sure.
So if somebody has it, say your grandfather has it, your father has it, and you have it, there's a good strong possibility that your male son will
Probably, especially if it's sort of an earlier, early onset of BPH at 50, 40, whatever. You have a higher likelihood that may happen. Grandfather, father, all the way down to son. It can, yeah.
I'm 80 years old and I don't have at all enlargement of my prostate gland, but my PSA is very, very high.
Okay.
How often is that?
How often can the PSA be high but the prostate not be big?
There is no enlargement at all, but the PSA is very high.
If the PSA is high, but then the prostate isn't necessarily enlarged, then you really have to be concerned about prostate cancer as opposed to just prostate enlargement. That's what the red flag would go up for me. Yeah, and we'll go into that a little bit later too. This is for enlargement. This is non-cancerous growth.
I'll ask a follow-on to his question.
Yeah.
If the genetics does it come down through the father, or is it like baldness? It comes down through the mother, and you know?
I don't know that.
Okay.
That's a good question.
I'm looking around here and I see several bald men, including the one in the mirror.
That's a good question. But you bring that up in the, it may have a role because the Proscar and Avodart that we use to treat BPH is actually Propecia. It's the same medication, just in a lower dose. So there may be a link.
So you get hair and a shrunken prostate.
There you go. Yeah. 2 for 1. There were countless studies. 2 of the more well-known longitudinal studies are the Baltimore Longitudinal Study of Aging and the Olmsted County study. These are large-scale, long-term longitudinal studies. Basically, they're following thousands and thousands and thousands of men for 30, 40 years. Everything from smoking to development of hypertension to diabetes to cancer, and they analyze all the data. What they found is sort of what we thought, at least now it sort of makes sense. BPH is a gradual progressive disease. In general, the older you get, the larger the prostate will get. The volume increases with age with an average of 1.6% per year. In addition, symptoms worsen with age. The older you get, the worse symptoms you have. If you look here, you focus on just the weak stream, the older you get, the higher percentage that you'll have a weaker stream as you get older. In addition, the urgency worsens as you get older, as well as the frequency, and the nocturia is waking up at night. So this sounds very doom and gloom. In addition, the urinary flow rate decreases as you get older, as well as the volume. So as you get older, the volume and flow rate decrease. In addition, the risk of acute urinary retention, meaning all of a sudden you just can't pee anymore. The prostate gets bigger and bigger, the bladder's working extra hard to sort of compensate, all of a sudden the bladder just can't take it anymore. It's like your heart having a heart attack. It's trying to keep up, having high blood pressure, high cholesterol, and it just sort of says, I quit, I can't do it anymore. So that increases as well with age, as you can see here.
Does the PSA go along with that then too?
PSA goes up as well. So the larger the prostate, the higher the PSA, which that's part of the controversy in prostate cancer screening when we're checking PSA values. As you get older, it's supposed to get larger because the prostate gets bigger. So it can be hard to sometimes differentiate between, is it cancer or is it just natural enlargement of the prostate?
What's the normal range of the PSA?
It used to be 4 and under. That's not necessarily the case now. We actually go by age cutoffs. So in your 40s, it should be 2.5 or below. In your 50s, 3.5. In your 60s, 4.5. And in your 70s, 6.5 or below. And the reason is for what we just said, actually. As the younger you are, the less likelihood you should have enlargement of the prostate, which means the less likelihood your PSA should be high. So if it is, it's more likely due to cancer as opposed to enlargement of the prostate. Does that make sense? Mm-hmm. Okay. As you get older, the prostate's going to get bigger, your PSA is going to go up, so that cutoff level goes up. Okay. So if you're 70 and your PSA is elevated, you're just as much more likely it's going to be due to enlargement as it is to prostate cancer. But if you're 40 and your PSA is 6, it's probably not due to enlargement because it's not common to have it at 40.
But I notice sometimes, like when they do mine, they give two values, and one of the values is the unknown, which is back, I think his question was, and that was on the population, African Americans should be at a certain rate versus those that are non. And what role does that play? Because sometimes, it's a little confusion because then you say, like you just said, that's the normal.
It's a lot of confusion. It isn't a little
yeah,
confusion.
and then they come back to me and they say, no, in your group it should be this.
Yeah.
And it's sometimes it's a little
There's
hard to figure it out.
there's no one way to do it. It's very confusing for us. There are about 1,000, if not more, articles on prostate cancer that come out every month, literally every month, and a lot of them refute what was put out the month before. And I do this for my living, and it's confusing, and it changes monthly, yearly. It's very confusing for patients, and there is no one right answer. We just don't know. We don't know, but the PSA. As an African American, you do have a higher risk of prostate cancer as well as a higher risk of more aggressive disease. There are some people feel there should be different cutoffs between race as well. That's controversial, and in general, the cutoffs I gave you are sort of what is standard used, but there are other cutoffs, and some people use different thresholds.
And some of them do different tests. Like I'm a participant in the Baltimore longitudinal
Oh,
study.
yeah, okay, good.
Right, and when it gets to mine, they do extra tests. They do different things because of the fact, I'm an African American.
Yeah.
Like you were saying, that different things affect different areas and so forth. Of course, they do a lot of things.
Yeah.
I've been on the study about 18 years.
Really?
So
Okay.
what they do with it.
Yeah, I mean, there's PSA, there's percent-free PSA, there's some, there's an ultra-fine PSA, there's a PCA3 test, which is a newer urine test. So, I mean, there's no perfect test. PSA is not a perfect test by any means, and we'll go into that a little bit, but there's always things coming down that are hopefully better, but right now it's really the best we have and the most commonly used.
Are the cutoffs at the various ages, are those scientifically based or guesstimates?
Yeah, I mean, there's no one number that says you don't have prostate cancer. Okay, so if you're 50 years old and you're under that threshold of 3.5, it doesn't mean you don't have prostate cancer. It means you have a lesser likelihood of cancer. You could have a PSA of 0.1, doesn't mean you don't have cancer. I can't say you have a 100% chance of not having any cancer, prostate cancer. But there has to be a cutoff somewhere. I can't biopsy every single person that walks in the door. It's just not feasible. So you have to draw a line somewhere. And the experts have sort of agreed as best they can at the moment that that's what the cutoff is. But that changes in just short, a few years ago it was 4, but that has changed, and I'm sure it will change in a couple years too. And it will probably change due to there may be some genetic test that comes out. That's really the holy grail, is a genetic test to say, okay, what's your risk of having prostate cancer as a genetic level? Because all we have right now, PSA values are guesstimates. It really is.